Hello everyone, good evening. So I have to take a minute as we start to say kind of who I am and what I'm bringing tonight when I speak. And the first is, I was born at Community Hospital of the Monterey Peninsula. I've been a lifelong Monterey County resident. I'm a parent, I'm a spouse, I'm a community member. I'm someone just like you who's listening. And I want to share my personal experiences as a person, my medical experiences as a doctor and medical director. And you're probably wondering why I'm wearing this goofy mask right now. And I'd like at this time to invite my mask assistant up to assist me here. So I can say as a parent, I've really struggled with what do I do when my child does not want to wear masks. And so fortunately I found that wearing funny masks is a great way to engage small persons like my daughter to actually want to wear a mask. So we found these. My daughter's a cat and I'm obviously a dog. And I can also say, thank you very much, mask assistant, that I've also found luck with the, where did I put it here? The rainbow unicorn mask was another hit with my 10-year-old daughter. And something that I found as a parent is that once I was able to make masking fun, it was something that my daughter was willing to do. And again, to follow Monica's lead, I'm gonna take my mask off, apparently my glasses too, just to make understanding me easier. But I want to say that masking is an extremely important part of all of our efforts against the coronavirus. Our hospital CEOs had a press conference yesterday, and Dr. Gary Gray from Natividad pointed out that if we all wear masks, we can save as many as 5,000 California lives. So I can tell you, me and my family, we are going to do our part. One other thing that I just wanted to say is thank you. Thank you to our first responders in the 911 system. Thank you to our doctors and nurses. Thank you to our respiratory therapists, our pharmacists, those working in our supply chain to get the supplies we need to the hospital. Thank you especially to our environmental services folks who are cleaning our rooms and making sure that when we bring patients to rooms, we know they're clean. Thank you to our other essential workers, those working in agriculture, gas stations, FedEx, grocery stores, driving our buses. Thank you to the people that are donating personal protective equipment like masks to Community Hospital. And I also want to take a brief moment of silence to honor those who are currently sick in the hospital and those who have died from coronavirus. And on that note, I think we can start going on to some questions. There's a lot to cover. I'll do my best to be simple, clear, and my most powerful message and tool tonight is going to be that all that I'm telling you is what I believe to be true as a physician, having researched this, having lived it, having taken care of coronavirus patients. I want you to know what I know so we all can be safe together. I think we're ready for our first question.
Great, thank you, Dr. Grover. I was wondering if you could just give us a brief update on your role with the emergency department and how Chomp and specifically your department is currently faring with the pandemic.
Absolutely. So I am an emergency physician. I am truly on the front line along with my staff in the emergency department. In fact, I work tomorrow morning in the ER. And I'm also our medical director of the emergency department, which means that I am responsible for overseeing the medical care from a doctor perspective in the emergency department. And that's been very time consuming and something that's required a lot of work with the pandemic because we're having to learn how to do processes differently. For example, getting patients into masks, how to take care of heart attacks, how to make sure that every room is properly cleaned when we have a higher level of infectious threat than previous. I am very proud to say that the people that I work with every day are so hardworking and so dedicated, and we're all really focused on several things. The first is our patients. The second is our patients and our staff safety. The third is providing the highest level of medical care that we can while being safe in the setting of this global pandemic. And I can tell you, there have been times when we've been scared, and there have been times that we've cried together, and we are very grateful for all the support of the community. For example, people have drawn photos or sent thank you cards. It means the world to us. So bottom line, we are here and committed, and we are trying our best to take care of each other during these stressful times.
Great, thank you. And we really appreciate you guys. Okay, this first question has to do with testing.
Uh-oh.
There were several questions, so I'm just going to do one that may summarize what people are talking about. If I don't have symptoms, and I want a test. Can I get that test at Chomp, or where can I get one?
So that's a fantastic question. So one thing that's important to know is that the circumstances change almost daily. As an example, early on in the pandemic, I was sending daily email updates to my physicians and nurses because there were so many changes and updates. In fact, I sent daily emails 85 days in a row simply because there were so many new and changing things. So in Monterey County, we started out with very restrictive testing. Very few people could get a test. And as our numbers were lower and we had good testing supplies, that loosened up, and really anybody who wanted a test could get a test. And with numbers rising in our community and in our hospitals, right now we are having to reserve test supplies to ensure that we have enough supplies to test all hospitalized and ill people. That's not to say that we're running out, but we need to realize that coronavirus is not a sprint, but a marathon. And we have to be sensible about how we use our supplies. So, Monica, to answer your question, right now, we do not test anyone at community hospital that is not having any symptoms. The one exception being is if people are about to have surgery. Let's say, for example, you're scheduled for a joint replacement surgery, the hospital will contact you to arrange testing so that we can know you're safe to go to the operating room in advance of your surgery. But if you come in with a cough and a fever, we are happy to test you in our emergency department. If your neighbor got tested for coronavirus and you're worried, we at Community Hospital of the Monterey Peninsula are not doing any asymptomatic testing. And again, asymptomatic means you're not having any symptoms of coronavirus like loss of smell, loss of taste, cough, or fever. And as I mentioned, as things are changing, what I'm going to give you, I think, is the most sensible advice is to go to the community hospital's website, chomp.org/coronavirus, for the most up-to-date information on what sites are available, hours, times, locations, in order to get a test if you're asymptomatic and you're concerned.
Wonderful. Now we're going to go to a question that just came in from the
Sure.
live feed. Do you recommend spouses wear masks at home when one spouse works in the community and they have a baby at home?
So that's a very good question. And this goes a little bit back to masking in general. So what do masks actually do? And masks really do 4 things, okay? The first is if you are infected, if you cough or sneeze, those infectious particles stick to the inside of the mask and prevent them from going out into the room around you. Number 2 is they also act as a barrier between yourself and the infectious particles around you. If someone in the room sneezes, those particles will not go into your nose or mouth, they'll land on the mask. The third thing is that they will block the spread of infectious particles from your hands or other objects to your nose and mouth. So if I, for example, give someone a high five and then rub my nose, I might have put those infectious particles into my nose and mouth. And then this isn't really a huge benefit, but like my daughter and I demonstrated, it can actually be fun. So in somebody who's a healthcare worker, in theory, by them masking and following appropriate policies and procedures for personal protective equipment, the risk of an exposure to a healthcare worker while at work is low. As an example, when I go into work, I am always wearing my eye protection. I put on my mask before I even go into the hospital. I fill out a pre-shift questionnaire so that I can be sure I don't have any symptoms. And then I go to work. I wash my hands or sanitize my hands all shift. If I have to take off a mask, I do so very carefully. It's only to change to a different mask if it's needed. And I have taken care of patients with coronavirus. I've intubated, meaning putting someone on a breathing machine, people with coronavirus. And in my family, in my home, we are not wearing masks because we know we're taking all the precautions. Now, that being said, if you're fearful and you want to wear a mask at home, that is totally reasonable. Or if you're a spouse and your significant other comes home from work and says, I think I got exposed, then it would be totally reasonable to wear a mask. But it's important to understand what masks do so that you can understand how they can benefit you.
Great. Given there is indication COVID-19 doesn't affect young children as severely as adults and they don't spread it as much as adults, is it okay to send young kids to school if all the recommended protocols are followed?
I have to give kudos to the community because these are all fantastic questions. So when we think about COVID, in a person, we have to think about really two things. The first is, what will it do to that person? So for example, I'm 36 years old and I have asthma. I might be higher risk than the average person to get COVID because I have an underlying lung condition. So I have to take extra precaution because of my asthma. Now, let's say I get COVID and I am able to spread the virus, which we know happens before I develop symptoms, and I go give my grandmother a hug. I have now taken the coronavirus from me and given it to a person who is much higher risk, somebody in the older population. So the issue with kids is, kids may do fine, but it's what happens when they bring it home that is really the big concern. In my home, there are only 3 of us, but there are other homes in this community where there might be several generations. And if a student goes to school and contracts coronavirus and brings it home, we may see an increase in the illness in our older parent, grandparent, or even great-grandparent populations, and that's a much higher risk. So I'm going to say, until the spread of coronavirus in our community has decreased, I don't think, out of precaution for our older adults like parents, grandparents, and great-grandparents, that sending kids to school is a good idea. I also say that knowing that taking care of kids is extremely challenging when we're all trying to work. And my heart goes out to anyone like me who's a working parent who's desperately trying to figure out childcare when my child is not in school.
So this is a question from the live feed. If you order takeout food and learn the next day one of the employees tested positive, should we be concerned?
So it really kind of depends on how you and the takeout person approached the takeout interaction. Okay, so my family is trying to support local business. We've occasionally been getting takeout, and the way we did it is the takeout person wore a mask. They dropped the takeout carefully, thank you, on our front doorstep. We waved through the front window. My family then put on masks, sanitized our hands, picked up our takeout. We took it out of all the plastic materials, put it onto plates, discarded the plates and, we discarded like the boxes and bags, cleaned our hands, and we were ready to eat. That's pretty low risk. That being said, is if you met the person in person, let's say you gave them a tip hand to hand, there wasn't masking, that could be a much higher risk interaction. And I think you're gonna start seeing a theme tonight, is that if you're smart and you think through what you do, it really drops your risk of coronavirus. For example, if you need to go get gas, clean your hands, put on a mask, pump your gas, clean your hands, it reduces your risk pretty significantly. So I'm going to leave it up to the person listening to look back at their own interaction with the takeout service to say, if I was really smart, the risk is going to be very low. If my risk wasn't so, if my risk was higher, like I forgot to wear a mask or I forgot to hand sanitize, then that's something where you might want to monitor symptoms. If you're going into work in person, you may want to talk to your employer about working from home for a period of time. You could even, again, go to one of our testing sites in the community, such as Salinas or Greenfield, to get a test.
So a few people asked about treatment for coronavirus once they're at the hospital. Can you talk through what we are currently treating and maybe about some other more controversial treatments that are out there?
Absolutely. So really right now, we're finding that coronavirus is basically falling into a couple different categories of illness. You have mild to moderate, and those are the people that don't have to be hospitalized. Those people might be treated with things like Tylenol or ibuprofen, lots of fluids just to kind of help themselves feel better and stay hydrated as they get through their illness. Severe illness is somebody who's going to require hospitalization. They require oxygen, they have a lot of fluid in their lungs. And then critical are the people that are on ventilators, those are breathing machines in the intensive care unit. And we basically know right now about 3 different therapies that in the scientific trials have actually shown some benefit. I'm just going to take notes to make sure I didn't miss anything here. So one we know of is called dexamethasone, and that's a steroid, and that's been shown in some recent studies to reduce mortality. That's how many people die from the illness. There's also an antiviral medication called remdesivir. which has also, again, shown some benefit in reducing mortality in scientific studies. And then additionally, we also have what's called convalescent plasma, which, Monica, if you were to get coronavirus and survive, obviously I hope that's the case.
Thank you.
You're welcome. Sorry. You would have, and we don't know the duration of, but you would have antibodies to the coronavirus. And there's a period of time where if you donate blood, your plasma, the part of the blood that doesn't have the red blood cells, contains those antibodies, and we can give that plasma to somebody who has the illness, and your antibodies may help neutralize the virus in the person who's sick. So those are the three that we know right now that are proven to work. And I'll just briefly take on hydroxychloroquine. I'm going to leave the politics aside. Again, my role here is I am a doctor in our community, and I've done research, and this is what I know is the most honest answer. What we struggle with hydroxychloroquine simply comes down to how we study medications and how science works. Let me give you an example. Let's say there's a cardiologist who says blueberries reduce inflammation, so I'm going to give all my heart attack patients blueberries. And this doctor treats 100 heart attack patients with blueberries, and he says, holy smokes, only one of my patients died. The new blueberry heart attack treatment saved 99 out of 100 lives. And we might say, holy smokes, call the blueberry growers. We've got to get blueberries in every hospital. But without comparing it to a control group, you don't know if it was the blueberries or if it was the aspirin or if it was a blood thinner or it was the fact that they opened up the artery that was blocked. So let's repeat that study. 100 patients getting heart attack treatment and blueberries, and just 100 patients getting heart attack treatment. And if in both groups, 99 people survive, it turns out it wasn't the blueberries. And so that's been what we've known with hydroxychloroquine. The initial study showed a very small number of people who doctors said, well, we think it might work, let's try it, and there was no control group. So I printed out a couple of scientific studies today. So this is from the New England Journal of Medicine, which is kind of like the Lamborghini of medical journals, meaning what we consider to be kind of the best and the most reputable. And this is a study dated July 23rd of 2020, which is hydroxychloroquine with or without azithromycin for COVID-19. And this is the conclusion. Among patients hospitalized with COVID-19, the use of hydroxychloroquine alone or with azithromycin did not improve clinical status as compared with standard care. So that's a randomized controlled trial of 667 patients. And here's another one that says a randomized controlled trial of hydroxychloroquine as post-exposure prophylaxis for COVID-19. That would mean, Monica, if you were exposed, you would take the hydroxychloroquine to reduce your exposure. The conclusion, hydroxychloroquine did not prevent illness compatible with COVID-19 or confirmed infection when used as a post-exposure prophylaxis within 4 days after exposure, and that was 821 patients in a randomized controlled trial. So what I can say is that, and I won't take everyone's time going through the trials of the dexamethasone, the remdesivir, and the convalescent plasma, but that's how we're thinking about it as doctors. You take an intervention, you compare it to a patient who doesn't get the intervention to actually see the effect. I hope that was helpful.
Yes, thank you. And I know that we are using a lot of those methods too, except for the
Hydroxychloroquine,
yeah,
right?
exactly. We're using those to help treat our sickest patients.
I worked 3 nights ago in the emergency department and gave 2 of my patients dexamethasone who were ill and admitted with COVID-19.
Great. So just a few more questions about families getting together.
Of course.
Is it safe for out-of-town family members to come visit my 94-year-old relative? If they do come, are there precautions that could reduce my risk to my 94-year-old?
So I'm going to speak as a frustrated parent, but also as a doctor. So my daughter misses her friends, and she keeps telling me, Daddy, it's going to be fine. I don't have any symptoms. They don't have any symptoms. And part of me wants to say, yes, let's go have a play date. But here's what we know about COVID-19. Unfortunately, people have what I'm calling, and I think is a pretty good term, people can have the ability to transmit disease when they are pre-symptomatic. So Monica, I apologize, I'm going to pick on you again. Let's say today you get exposed to coronavirus and you contract the infection. You may have no symptoms for up to 5 days or even longer and yet still be shedding the virus. And I might see you tomorrow at work and be like, Monica, hey, how are you? Give me a high five. Great to see you. And yet you didn't know that you were spreading virus because you were pre-symptomatic. So right now, really the smartest thing to do is assume that people around you could be pre-symptomatic. And what do? Here comes that theme again. We're going to keep our hands clean. We're going to wear a mask. And we're going to use social distancing as best we can, obviously depending on the circumstance. When I'm in the ER and we're doing CPR, there's no way we can be socially distant, so we're wearing very special masks to allow us to be in close quarters, taking care of critically ill patients. So to this person's question, it's ultimately your decision. You may decide that you want to bring family in because your 94-year-old relative might be near death, and it means the world to you to have that encounter. But realize that just because somebody feels fine doesn't mean there's zero risk. So if you decide to bring them, clean hands, stay 6 feet away when you can, and wear a mask. Those are all ways to reduce your risk.
Okay. If someone gets infected, how soon after the initial onset can a nasal swab detect the virus?
So that's another very good question. And the way our nasal swabs work is they're called a PCR test. And what that does is it basically uses certain techniques to detect viral particles. So let's say, for example, I go home today and I'm getting gas, and the guy at the gas station, or the guy next to me, I'll say, sneezes, and I inhale the coronavirus particles because I forgot to wear my mask. I'm developing coronavirus infection, but the virus has to replicate in my body. So if I think, oh my gosh, I got sneezed on, and I immediately go get a test, it's not likely that there's enough viral particle to detect the virus and confirm that I have an infection. So the answer is it really depends on what level of the virus is in your body. And to my knowledge, we don't really have any way to predict which person will have enough virus to be detected. If you think you're sick and you need to get tested, that is very reasonable. One of the downsides of asymptomatic testing is you may not have enough virus to actually test positive, and it might give you a false sense of security. So if you have questions, you can certainly ask your doctor. There are multiple information lines throughout the county. Chomp's information line, I'll give it to you, is 831-622-8001. And we're really just trying to be able to, as good scientists, collect the data to be able to give people the correct answers when we give them advice. I will be very honest, I don't know the exact answer to that, and it's going to vary person to person. But again, asymptomatic testing is a little dicey because you may not have enough virus to test positive.
Mm-hmm. And another resource that's helpful on chomp.org/coronavirus is the free e-visit program for those that do have symptoms. So if you needed some free advice, you can go on there and we can have a doctor respond to you with your questions.
Fantastic suggestion. I totally forgot about that.
No, great. So a question that came in, I'm scared to come to the ER because I'm worried about getting the virus or another illness while I'm there. What are you doing to keep us safe and make me feel better about coming to the hospital?
I think I could probably spend the whole hour talking about what we do to keep our patients safe. But let me start by saying that after I finish this interview, I am taking one of my family members to community hospital for some testing on an injury, meaning I have confidence in my hospital and all of the people working at Montage Health that I'm taking my family member to get testing inside the hospital at community hospital. It's not related to coronavirus, but I feel comfortable and I feel safe doing that. So let's start by testing staff. So before every shift, I, as any Montage Health staff member, have to fill out a pre-shift questionnaire. I would actually do it on camera, but it takes about 2 minutes and I prefer to answer questions. But the bottom line, I have to answer questions. Have I been exposed? Have I had any symptoms? Am I living with someone who has COVID-19? Have I had a fever? And only by answering those questions correctly, accurately, and in a way that I don't appear to have coronavirus can I even enter the building. When I am entering the building and everywhere on the campus, I am wearing eye protection and I am wearing a mask. In addition, we are really working diligently to keep our patients safe by using distancing, screening, and, for lack of a better word, quarantining for patients. Let's say, for example, tomorrow morning I'll be in the emergency department. We get a patient who's critically ill. A nurse who's in full protective equipment will alert the rest of the emergency department that there's a critical patient. We will all put on our appropriate extra level of protective equipment for critical patients. We will go attend to that patient in a specialized room with a viral filter in that room, okay? Let's say you've fallen and you can't walk and you think you broke your ankle. We have a line to check into the emergency department. We try to keep it moving as quickly while being safe. And there's 6-foot waiting spots for people to wait. If a person, when the nurse in our triage area screens the patient and they have any symptoms or any questions that make us concerned, and there might be coronavirus, they get taken to either a room where they can be quarantined or our respiratory tent, which I'll talk about a little bit as well. And if you don't have symptoms, we make sure you're masked right away so that you're not exposed. If you do have symptoms, you're masked right away so that you don't spread any symptoms. So, and then also all of our rooms are thoroughly and regularly cleaned. Any patient who's been in a room who's had coronavirus, thank you so much to our environmental services folks who are doing a fantastic job doing what's called a terminal clean, meaning they clean every surface, they clean every last part of that room, and we have to allow time for it to actually, all the disinfectants to work before we can see the next patient. Other things that we're doing, we have a respiratory tent. If anyone's been to our emergency department, it's a physical tent next to the emergency department. And I can tell you it's probably one of the safest places in the hospital. It has what's called negative pressure, meaning that a bit of air in that tent is sucked out to the outside. So let's say someone goes in and they have COVID, and someone goes in and they don't have COVID. The air next to the person with COVID is sucked out through a kind of a specialized airflow system so that the person who doesn't have COVID doesn't get exposed. And there's constant measures to disinfect every piece of equipment, every stethoscope, every provider's hand, every chair, every divider. We're constantly cleaning. So I think I'll stop there. Monica, if you have any things that you think I didn't cover, but that's just the tip of the iceberg. Whether it comes down to which disinfectant supplies we're using, whether it's policies for how we're admitting patients based on whether their COVID test is positive or negative, whether that's how we're taking care of women in labor, how we're taking care of emergency surgeries, how we're taking care of heart attacks. Every last process, protocol, and procedure at our hospital has been touched by coronavirus in a way that we know we're being safe. And if anyone who's listening in wants me to talk about a specific policy or pathway related to the emergency department or hospital, I can do that. But that's kind of an overview without taking too long.
Yes, that's a great overview. And we do have an infection prevention team, which is absolutely amazing.
Yes, they are amazing.
Dr. Blum, who was in our past Facebook Live session, also is just a great leader for us in making sure that we're keeping our staff and our patients and our community very safe. And just as a reference, we do have a recording of that Facebook Live, if you missed it, on our chomp.org page. So feel free to visit that later.
Yeah, one thing I think we should probably segue into, which was, I believe, another one of the questions, is we should probably talk about the visitor policy. And the visitor policy has been so frustrating. It's been so challenging, and it's been so hard. As a doctor, at one point, I actually was taking care of an older man in his 90s who was dying of a heart attack. And I was like 3 a.m, and I was trying to talk with his family of what were his wishes, how could we honor what he would want done. And the family didn't want to come to the hospital. They were afraid, and our visitor policy, we were still working out. This was in March. And so I literally was FaceTiming with his family on my personal cell phone with the patient, like, "Sir, this is your daughter. We need to try to make sure we honor your wishes." It's been so hard. And some people don't want to be admitted to the hospital because they don't want to be alone. Here's the bottom line. This is part of our effort to keep our patients safe. It goes back to the fact that you can be pre-symptomatic and you might feel fine. And when we screen every visitor at the door for a temperature, you might not have a temperature, but you could still be in the early stages of coronavirus. And the last thing we would want is you wanting to spread love to your loved one who, let's say, has a depressed immune system with diabetes or certain medications or cancer and to complicate their illness. And that's not to say that you as a community member are not going to be smart or you're going to do something intentionally. All of us just simply are at risk of being pre-symptomatic, trying to do the right thing and just not knowing. And once again, you'll hear me say this many times, washing our hands, whether it's hand sanitizer or soap and water, and wearing a mask can reduce all of those risks to patients. And so for certain populations, we are allowing visitors. For minors, for special needs patients, people who are at risk of falls, people who have dementia, cognitive impairment, sometimes even severe mental illness. We obviously don't want to put any patients at risk because they need extra support. And those visitors just have to be really smart. Again, hand hygiene, masking, and following all policies and procedures.
And I think what's nice is if you are an inpatient, we do provide the vehicles in order to be able to see your loved ones through FaceTime or other
Yes.
things. So the iPads are available
Yes.
and things like that.
Absolutely.
So this is a Facebook Live question. What are the long-term effects of COVID-19? Some reports say there is a long-term heart damage that's involved.
Yes, absolutely. So as we are learning more about this virus, we are beginning to see that it's not just a lung problem. And I think when we first were learning about this, we thought it was something that caused severe pneumonia, it caused lung failure. And what we're beginning to realize is, like most viruses, it affects almost the entire body, and we see certain organs affected more than others. One thing that we do know is that people sometimes come into the hospital, and for all intents and purposes, we think they're having a major heart attack, and they're actually suffering from coronavirus. Coronavirus can actually directly infect heart muscle. That's one way. The coronavirus also affects our blood and increases the risk of blood clots. That can be blood clots in the lungs, that's called a pulmonary embolism. Blood clots in the legs, that's called a deep venous thrombosis. It can also be blood clots in the blood vessels going to the heart, and that would be a heart attack, or blood vessels going to the brain, that would be a stroke. We're also finding that coronavirus affects the neurologic system, and people are getting confused or having mental health symptoms. I recently admitted a patient to the hospital with coronavirus who was having trouble walking. He was very off balance. And the other thing we also know is we're beginning to see different responses to the long-term effects of coronavirus in different patients. Some people are symptomatic for maybe 10 days, 2 weeks, 3 weeks. Some people are having symptoms that linger for months and are still not quite able to feel back to normal. And some of that may come from simply the scarring of the effects, from the effects of the scarring of the virus on the body. As an example, if I contract coronavirus and have severe coronavirus, there'll be a lot of parts of my lung that are severely affected, and some of those parts of the lung may never recover. So I may never be able to exercise the way I used to. Or somebody who has a heart muscle infection from the virus may have that part of the heart muscle be scarred permanently. So we're still learning more. This is something in the United States that we really have seen kind of here on a large scale in maybe late February to the beginning of March. So we're still just a few months into this, and we may find that folks have symptoms 6 months to a year, but we just don't have that time data yet.
Okay, do you have patients who come to the ER change to a clean mask when they come, and why are masks with vents not fully protective?
I'm sorry, can you say that again? Oh, the mask with the vents?
Yes.
Yes. What we know is that not every mask is built the same, and that industrial masks and medical masks are a little bit different. So this goes back to, again, what do masks do? They do 3 things. They keep you from touching your nose and mouth, they keep your infectious particles from spreading, and they keep other infectious particles from going into your nose and mouth. And when you have a mask with a vent, what the vent is designed to do is it's designed to make breathing easier because you can exhale through a vent. So what that does is if you have symptoms, that mask doesn't prevent anyone around you from your infectious secretions if it's got a vent. It's basically like not wearing a mask at all. So what we are doing when people arrive is we're putting one of our standard masks, like Monica, the one you're wearing, that we know keeps infectious secretions in and keeps infectious secretions out. Some people, when they come to the ER, they don't want to take off their mask. That's totally fine. If they have a vent, we're going to put a mask over the top of it. Our preference is that we let people use our mask, but I have seen people who come in, they say, I'm not taking my mask off, and we say, okay, but we're going to cover up that exhaust port with a regular mask so that all those particles from inside of the mask don't go out into our common areas in the emergency department.
Okay. There's a question about how many COVID patients are being treated at Chomp right now. This morning it was reported that there was 13, and if that's still the case.
Let me get my notes here. Let's see, I think I may have dropped my notes when I put down my exposure here. Here we go. So looks like some brief numbers in Monterey County. Looks like we've had 4,457 cases and 26 deaths. At Community Hospital, we've done 5,494 tests. We've had 186 cases and 2 deaths. And I believe I think you said it was 13 patients were in-house as of this morning. And that changes day to day as people get better or worse, or we see new patients coming into the hospital.
We've had a couple questions about car safety. If you have to be in a car with someone, what's the safest thing you can do?
Ooh, that's a good one. I don't know if there's any scientific data on this, but we know that the virus is spread through respiratory secretions. And I have taken care of patients who tested positive after being in a car with someone who was positive and was pre-symptomatic. So this is what I would do if it were me, based on the best knowledge that I have. As an aside, I'm not driving with anyone besides my family, and that's step number 1, which is to avoid as many exposures as you can. Now, let's say, for example, you are a bus driver. First of all, thank you so much to our bus drivers for their continued work. I'm gonna say that I'm gonna recommend we first use our mask, right? Because that's gonna keep any secretions that you have in and protect you from any secretions from other people. It's probably also helpful to create a little bit of airflow in a meaningful direction. Let me give you an example. So let's say that we are driving in a car with all the windows shut, and we turn a portable fan on inside the car thinking it'll move the air. It's probably just gonna swirl the particles around in a way that's gonna just spread them even more. They tend to, after a sneeze, go out and then kind of settle. So if there is, for example, some way to have a directional airflow, you could kind of experiment with that and see if it works. If this is something that you encounter in your job, you might want to see, does opening one window make the airflow in a meaningful direction? But we don't really want to just stir up the air kind of all over the place. I mentioned our respiratory tent is negative pressure. Again, what does that mean? It takes all the air inside the tent and it sucks it out and away from patients. And so if there would be a way to, again, move air from inside the vehicle to out without stirring it up too much, that would be certainly reasonable. In the absence of that, probably the single best thing to do, in addition to wearing a mask, would be to wear some sort of eye protection. And eye protection glasses don't count. You're going to want to have some sort of side protection. And that's what we're using in the emergency department. I wear, amazingly, my college chemistry lab goggles. They're just kind of a bulky lab goggle, because we also know that respiratory secretions can also get into the eyes as well. I apologize, I don't have a precise scientific answer there, but I think just to make sure I kind of summarize: wearing a mask, hand hygiene, avoiding exposures if possible, eye protection, and then if there is a way to create unidirectional airflow from in the car to out, that would be a reasonable approach.
Going back to the 13 patients that we had this morning,
Sure.
The question is whether or not all of those are in the ICU.
I actually don't know that number, Monica. I don't know if you do.
I don't, but I can say definitely not all 13
Correct.
are in the ICU, that they come in with sometimes other conditions and then are positive for COVID.
Yeah, the other thing we've also been doing, and this goes back to our discussion about safety is we've been cohorting patients in a way that sometimes people go to the intensive care unit, even if they're not necessarily on a ventilator, simply because the ICU has drilled and practiced how to take care of COVID patients. I just got an update that we have 3 patients in the intensive care unit as of this morning. And again, I don't know if those are ventilated patients or those are patients who are just sick and being monitored, or those are patients that are just there simply because our ICU staff has drilled and practiced and has all the right equipment.
All right, thank you. Since my daughter works in the emergency department, should I stay away from her?
This is one of the saddest parts about COVID, is that we miss each other when we need each other the most. I can tell you personally, I've basically cut off contact with everyone except my wife, my daughter, and myself. I adore my family, but I've asked them to stay away as an extra precaution, simply because I am very high risk and I take every precaution at work. I don't believe that I'm taking any chances, but if I have a family member and I was irresponsible and transmitted to them, I don't think I could ever really be comfortable with knowing I could have done it better. So my personal preference is that I am isolating away from other people as a person who takes regular care of people with coronavirus. It ultimately becomes a family decision. If now one of my family members was critically ill, or we had a death in the family and we had to come together, then obviously I would take every precaution. Again, hand hygiene, masking, 6 feet social distancing whenever possible. But in general, I'm going to recommend that if you are exposed to coronavirus patients as a part of your work, that you stick to kind of your immediate family if you're comfortable with that. I know some people have also even decided they're going to stay in a different part of the house. People have to be kind of comfortable with their decisions. It's a really tough question because we need to be able to hug and show our love for each other more than any other time in anyone's memory, and yet I think just being smart and FaceTime rather than an in-person visit is probably the smartest thing.
And we appreciate everything that you guys do in the ER, because you're putting your health on the line every day. So we appreciate that.
And I have to give major credit to Community Hospital as well as the other hospitals in the county and the health department for really working to make sure that our staff have adequate personal protective equipment, so we can go into work with confidence knowing that we have the supplies that we need to be safe and still be able to work and yet not get sick and come home to our families.
Is someone with diabetes more susceptible to the virus?
What I can tell you is that we are still trying to figure out exactly what determines a person's susceptibility. However, diabetes does suppress a person's immune system, and in general, people with diabetes are more susceptible to any infection. So by extrapolation, we can say that most likely patients with diabetes are more likely to be affected and susceptible to the coronavirus. What we also know is that people with diabetes are more likely to get more severe disease. And that's not unique to coronavirus. That's the same with urinary tract infections, skin infections like cellulitis, and influenza. What's really funny is people have focused on, oh my gosh, I've got medical comorbidities, which basically means I have medical conditions. I'm all of a sudden at risk for COVID, but you're at risk for stroke, heart attack, really bad urinary tract infection, bloodstream infections like sepsis. Any medical condition increases our body's susceptibility to a number of different illnesses. So diabetes falls under that. So yes, I do believe that a person is at much higher risk if they have diabetes if they're infected by the coronavirus, as this person asked.
Great. Does outdoor dining make any difference at reducing chances of getting COVID?
Yeah, I mean, this goes back to airflow, right? So the reason why we're trying to do things outdoors is simply because the natural airflow is going to move those viral particles away from people, as opposed to being in a small room where there's a lot of shared air. My heart and my condolences go out to the restaurant industry and also bars. they've been hit extraordinarily hard, and it's been a really challenging time. And I give my kudos to restaurants that are thinking outside the box and being creative and opening up new takeout and delivery menus. My gratitude aside, the question is, what does outdoor dining do? And really, I think it's the smartest way right now we know of to be able to do restaurant dining outside of takeout or delivery, simply because, again, what we know is that this virus is spread by respiratory droplets, and when we're eating, we don't have a mask on. So sitting in a closely packed restaurant or bar with not a lot of airflow is a prime setup to spread respiratory particles around multiple tables. So again, that little bit of airflow from being in an ambient environment, maybe even some wind, is going to reduce the spread when people aren't wearing masks while they're dining outside.
Can COVID be transmitted any other way than mouth and nose?
So there's a term in medicine called a fomite. And a fomite is something that you touch it, and whatever infectious particle is on it, it spreads to you, and then you touch your mouth and your nose or your eyes, and you can get it. So here's fomite number one, which is we often don't think how often we touch our phones and how often we've cleaned our phones. I can tell you my staff in the emergency department will either put their phones in a plastic bag, or they will, either with hand sanitizer or a cleaning wipe, disinfect their phone at the end of their shift. So this goes also back to the school argument that a child, let's say, for example, they were exposed to the coronavirus at school, they might have coronavirus from someone's secretions on their hands, they give you a big hug and a kiss after school, that could potentially spread it. So really the issue is, again, when you touch something like a gas pump, clean your hands afterward, particularly when you're, I'm sorry, I lost my train of thought there. Very important to clean your hands after touching any common surface so that you don't go back and touch your nose and your mouth, and therefore you might infect yourself. And the reason I got distracted and lost my train of thought is I wanted to do a little experiment here and to talk about gloves. So I brought some gloves with me, and we're gonna see if gloves by themselves really protect me from coronavirus. So I see a lot of people outside, using gloves, and let's say, for example, somebody wants to pump gas with gloves. Gloves are great. I wear them all the time in the emergency department, but really they're not that different from your hands. So, oops, wrong pocket here. So let's imagine that this sunscreen here is coronavirus, okay? So let's say, for example, I go to the gas station and I finish getting gas and I have coronavirus all over my hands. Unless I carefully take my gloves off and clean my hands when I rub my face, oops. So fortunately it's sunscreen, so I can actually rub it in here, sorry. But anyways, I'm sure someone will tell me if I have any white spots. But anyways, the reason I bring this up is that it's all about cleaning your hands. And so the gloves don't actually make that much of a difference. Apparently I still have sunscreen on me. And so it still comes back down to cleaning your hands, because that reduces your risk of getting any sort of infection from an object.
We've had a few people ask about remdesivir. Is it the primary treatment for early stage COVID patients at Chomp?
Unfortunately, remdesivir is an extremely short supply. Right now, of the three therapies that I mentioned, convalescent plasma, dexamethasone, and remdesivir, we have loads and loads of dexamethasone. In the county, we have a very short supply of the convalescent plasma and of remdesivir. So what I love about what's happening in Monterey County right now is all four hospitals are working together to be able to give the doses of remdesivir when it's needed and when it's available. So my infectious disease colleagues here at Chomp might say this patient we think really would benefit from it. They may contact Salinas Valley to be able to get doses that are needed. And when Natividad has a patient or me has a patient, we might give them those doses. So simply because of its short supply, it's not our primary treatment right now. We're really using dexamethasone because it's available, we can use it reliably, and the studies have shown very, very encouraging results on reducing the mortality, that's again how deadly it is, in patients with moderate, severe, or critical illness.
Hey, we had a question about household cleaners. I'm not sure how much
Sure.
of an expert you are on that, but I'm going to ask it. Are any particular household cleaners more effective against COVID?
So I think the best question is, how much do we actually read the instructions on the cleaners that we use? Let me give you an example. We have ones at the hospital called Oxycide, and those are ones that we can basically just kind of clean, and it cleans relatively quickly. When we use bleach wipes, it actually takes longer for the bleach to work, and so we can't use those items right away. Both of them are totally effective, but if we don't actually read the instructions, then the bleach may not be as effective. Probably the one I use the most around the house for things like things like phones and keys is hand sanitizer. It's available in large jugs all over the hospital. We have little dispensers for it. A lot of stores have the touchless ones. I was at 7-Eleven buying milk the other day, and I walked in and they had a touchless hand sanitizer. I hand sanitized on the way in. So really what you want to look at is on the label, what does the product kill? And it'll usually give you a percentage of bacteria and viruses that it killed. And it might say that it's bactericidal. It might say it kills 99% of viruses. Really what you're going to want to look is read the label, make sure that it kills 99% of viruses, and that you know how long it has to be in contact with the surface, and additionally, how long you need to wait after you apply it before it's effective.
Great. So we have about 3.5 minutes left.
This went quickly.
It did go very quickly. So I'm going to end with this question. What's the best medical and health lesson about this pandemic that you can give to our community?
Wow. At least you gave me an easy one to end on. I think I'm gonna give you 3 pieces of advice. Number 1, our world and our nation is suffering in unbelievable ways. Try to reach out every day to a loved one, a friend, a coworker, and just say, hey, how are you? I just wanted to send my thoughts. Thank you for what you do. Just take the love that you have and spread it, because Lord knows we all need it. Number 2 is be smart. And I know there's so much controversy and I know there's so much politics, but I can tell you as a doctor, and if you come to the emergency department tomorrow, I might be your doctor, clean your hands, wear a mask, reduce your exposures to others, and just try to be smart, okay? Number 3 is that this is a really tough time because misinformation is everywhere. And social media is all ablaze right now with videos being taken down and conspiracy theories. Go to a trusted source for your information. Chomp.org/coronavirus. Monterey County Health Department's website. We are really trying to get our best, correct, honest, and pertinent information to our community so people know the right decisions to make. And we on the medical side will still do everything we can to keep you safe when you come to the hospital. Oh, there's one last thing I wanted to say, and I apologize, I didn't think of this sooner. We're doing everything right now differently. My kid's not going to school. I'm now hand sanitizing when I buy gas. I'm having to do meetings via Zoom. Everything is different, and it's just kind of silly to assume that getting healthcare would be different. Please realize that you will need healthcare. You may need your routine checkup. You may injure your ankle. You may need a mammogram. You may need a blood draw. You may be having a heart attack. And just like everything else, we're going to have to keep getting medical care, and it's going to be different, and we have to be okay with that. Rest assured, people are doing enormous amounts of work to keep you safe, but we all have to be willing to keep getting health care even though it's different, and trust the fact that in our community in Monterey County, people are working night and day to make sure that we are all staying as safe as we can during these difficult times.
Wonderful. Thank you so much for your time tonight, Dr. Grover. We really appreciate it.
Thank you for the opportunity to speak, and thank you to everyone out there who's staying safe.